It's a pleasure to be here today. Can I start by also acknowledging the traditional owners, the Wurundjeri people, and pay my respects to elders past and present. I'm a kidney disease researcher and clinician, so I'll be learning a lot from today's discussion. I can tell you, as many people in the room know, that Aboriginal women aged between 35 and 54 are up to 50 times more likely to need dialysis or a kidney transplant than non-Aboriginal women in that age group. And the research that we have done has shown amongst people with severe kidney disease that screening rates for cancer are alarmingly low, and that the burden of cancer is high and that outcomes are poor. So I think there's a lot to share from thinking about complex chronic illnesses, how we can do the right research to improve access to care, access to evidence-based treatments and improving outcomes. It's a shared priority, so I really look forward to participating in discussions today. Until recently, breast cancer has not been a high priority on the Indigenous health agenda. Today, you're all going to be part of changing that. This is another step on the way to forging a coordinated, collaborative approach across the country to doing the right research to address disparities in breast cancer outcomes for Aboriginal and Torres Strait Islander women. 4 years ago, a national conference was sponsored by the Lowitja Institute, which was looking at identifying research priorities in Aboriginal and Torres Strait Islander cancer. It was a brainchild of Gail Garvey, who was then working at the Queensland Institute of Medical Research and the Lowitja. I'm glad to say that since then she's moved to Menzies. She's a wonderful researcher and she now heads our vibrant cancer research program and one of our main divisions of research in epidemiology and health services. A critical example, as Romley said, of Aboriginal people leading the research and the effort to bring people together to do the right work to make a difference. Last year, a group of national collaborators was awarded $2.5 million by the National Health and Medical Research Council to establish a Centre for Research Excellence, discovering Indigenous strategies to improve cancer outcomes via engagement, research translation and training. That's a mouthful, so they came up with a wonderful acronym, Discover TT. But that forms the basis for the nationally coordinated approach to Indigenous cancer research that this is part of today. Later that year, Gail and the team were awarded a further $1.9 million Strategic Research Partnership grant from Cancer Council New South Wales and funding from Cancer Council Western Australia to improve cancer control and outcomes for Indigenous Australians. Another roundtable was held last year in 2013, which led to the establishment of NICaN, the National Indigenous Cancer Network. And that's a collaboration between Lowitja, Menzies, the Australian Indigenous Health Infonet and Cancer Council Australia. NICaN is an online network that supports transfer of research knowledge and outcomes to the broad community, to researchers, patients, families and practitioners. This roundtable that we're holding today is the next step forward. What I think we all hope is that we will, talking together, identify the key priorities for research. What should we do? Who should we involve? Who are the right partners? How do we do the best work together that is likely, or more than likely, that will transfer to improving health outcomes for Aboriginal and Torres Strait Islander women, their families and communities. It's wonderful for me to see how far things have come since that first roundtable in 2010. We have already achieved many important steps, and I look forward to participating with you all and seeing what we can achieve to improve outcomes over the next 4 years. Thank you.